Today, we're going to talk about deconstructing CRPS, which is breaking it down into its components and what's going on in your body. This article was written by the late Dr. Robert J Schwartzman, MD. We're also going to talk about complications related to CRPS. Complications in this case are known as comorbidities. And this is also based on an article written by Dr. Schwartzman. So let's break things down. Complex regional pain syndrome, or CRPS, results from damage to C fibers and A delta fibers that innervate soft tissue and bone. In the great majority of instances, this is the cause of CRPS, 90%. 10% of patients have damage to the central nervous system pathways, such as stroke, head injury, spinal cord trauma, or multiple sclerosis. So, what is a C fiber? C fibers are unmyelinated fibers that combine to form one fiber and are involved with the afferent nervous system, which are the neurons that carry information from sensory receptors of the skin and other organs to the central nervous system. They can carry temperature, burning, pain, and itch from the periphery. And A delta fiber are larger and the most rapidly conducting of the two types. Because they have a thin myelin covering, and therefore they are associated with sharp, well-localized pain that first occurs. A delta fibers are activated by chemical and thermal stimuli. Pain signals. Pain signals go through specific pathways and direct these fibers to activate. The discriminative pain system, location, intensity, and quality of stimuli, the afferent system, the unpleasantness of stimuli, the autonomic nervous system, sympathetic reactions, the motor system, a system of nerve fibers that mediate pain sensation, and the immune system. So, how we get CRPS? About 50% of all people with CRPS have been casted. We are seeing more and more orthopedists using boots and braces rather than plaster casts. Not only was I in a plaster cast after the fracture, I was also placed in a plaster cast after my foot was fused. CRPS is rarely seen following a complete nerve transection, which means the nerve is cut in half. There are 4 distinct subgroups: abnormality in pain processing, allodynia, hyperaglasia, and hyperpathia. Hyperpathia is a painful response to stimuli. Allodynia is pain from something that normally would not be considered painful, such as the breeze from a ceiling fan. And hyperglacia is a heightened reaction to a stimuli. Skin color and temperature changes, differential blood flow, edema, and it's neurologic edema, which is vasomotor and pseudomotor dysregulation, and motor syndrome. The incidence of CRPS. Females, according to the most recent study, show that 40.4 per 100,000 people have CRPS. Males, the most recent study shows that 11.9 per 100,000 have CRPS. So females are more than 3 times more likely to develop CRPS than males. The average onset is between 36 years and 64 years of age. The most common causes of CRPS are fractures, sprains, soft tissue trauma, which is when there's an injury without a fracture, and surgery. Incidence of symptoms. Neurogenic edema or swelling occurred in 75% of patients within 1 year and 90% of patients within 15 years. Generalized edema or swelling was variable and increased from 33% during the first 5 years to 44% after 15 years. One component of movement disorder occurred in almost all people with CRPS by year 5. Pain in the internal organs was reported in 47% of the people with CRPS within the first 5 years and 62% by year 15. Other prominent symptoms include difficulty sleeping, prolonged latency, and multiple awakenings through the night. Cognitive dysfunction, decrease in short-term memory. If you remember back to what is CRPS, we talked about some of the components that carry the CRPS pain are also components that carry short-term memory, and therefore they prevent short-term memories from forming. Gastroparesis, a slowing down of the digestive system with delayed stomach emptying. And this can vary from just having some nausea and being able to still eat to requiring a feeding tube to bypass the stomach and go into the jejunum to receive a formula feeding. Difficulty in swallowing. There's spasming within the esophagus. Loss of voice, paralysis of the muscles that open and close the vocal cords, inability to initiate urination. Presyncope, which is a vasodepressor and causes near fainting or dizziness. Rash, itching, headache, such as migraines, and blurred vision. On to the second part, complications or comorbidities of CRPS. Things that present with CRPS, and this is an overview. We will go into more detail in future shows. So, complications or comorbidities of CRPS are conditions that often go along with CRPS. We will give a brief overview in this show, and more detailed shows will follow in subsequent weeks. Neurophysiological deficits associated with CRPS. CRPS is a neuropathic pain disorder. It causes autonomic dysregulation, a nervous system disorder that disrupts the autonomic body processes. So, what does the autonomic nervous system do? A component of the peripheral nervous system that regulates involuntary physiologic process, which includes your heart rate, your blood pressure, respiration, digestion, and sexual arousal. So these are things that the peripheral nervous system regulates that are body systems that we have no control over. It is part of the peripheral nervous system. Your peripheral nervous system is everything else and includes nerves that travel from your spinal cord to your brain to supply the face and the rest of your body. Peripheral nervous system bundles are bundles of nerve fibers or axons that conduct information to and from the central nervous system. The autonomic nervous system is part of the nervous system concerned with the innervation of involuntary structures, such as your heart, smooth muscles, glands within the body. It is distributed throughout the central and peripheral nervous systems. Involuntary bodily processes. The autonomic nervous system is responsible for regulating the body's unconscious actions, your heart rate, digestion, blood pressure, respiration, and sexual arousal. Your enteric nervous system can operate independently from the sympathetic and parasympathetic nervous systems, but are influenced by them. A mesh of nerves that envelop the digestive tract are included, operates independently from the brain and spinal cord, controls the digestive enzymes, and controls the motility or movement within the digestive system. Parasympathetic nervous system activate activities that occur in the body at rest. Complementary to the sympathetic nervous system, the peripheral nervous system arises from the central nervous system. Sympathetic nervous system is the fight or flight component of the autonomic nervous system. Originally, it was thought that CRPS affected only the sympathetic nervous system, and that's why it was previously named reflex sympathetic dystrophy. However, once CRPS is centralized, we now know that it affects the entire autonomic nervous system. It is consistently active to maintain homeostasis. Homeostasis is a balance between interdependent elements. A major role in various physiologic processes, such as blood glucose levels, body temperature, cardiac output, and the immune system function. The neurophysiologic deficits of CRPS include about 35% of people with CRPS have no neurophysical deficits. Approximately 42% have mild dissecutive deficit. Executive function is the ability to make plans and carry them out. And this is disrupted in many patients with CRPS. Approximately 22% of people with CRPS have cognitive impairment that include poor performance of executive function, naming, and memory. If you remember back to what is CRPS, we talked about how chemical reactions within the brain can affect short-term memory. CRPS 1 and 2 are systemic diseases. Severely infected people with CRPS, which include with more than one limb affected, often have lethargy, tiredness, or weakness, the etiology of which is multifactorial. Following the injury, these are activated and move into the injured area, mast cells. Mast cells play an important role in how the immune system responds to certain bacteria and parasites, and they help to control other types of immune response. They contain chemicals such as histamine, heparin, cytokinase, and growth factors. Mast cell activation syndrome is common with those with CRPS. And the activation syndrome causes allergic reactions, sometimes very severe, in people with CRPS. Macrophages are a type of white blood cell that surround and kill microorganisms, removes dead cells, and stimulates the action of other immune systems. Leukocytes. White blood cells, also known as leukocytes, are responsible for protecting your body from infection. As part of your immune system, white blood cells circulate in your blood and respond to injury or illness. Constitutional systems as the disease progresses. As the disease progresses over time, pro-inflammatory cytokines released by angry glia cells increase in the blood and spinal fluid. Anti-inflammatory cytokines decline. Inflammatory cytokines act both peripherally at the injury site and in the cerebral spinal fluid. Immune cells are activated. If you remember back, this is what normal nerves look like, with the glial cells acting as glue between them. Glial cell activation. With persistent pain, the glial cells get angry. This is inflammation. The glial cells are activated. Persistent pain continues, and the glial cells release chemicals. It is this vicious cycle of pain and inflammation. This is what it looks like when the glial cells are activated and when they are angry, releasing the cytokinins. Cardiac issues in CRPS. Syncope or near syncope, which is fainting or dizziness. Atypical chest pain, POTS, which is postural orthostatic tachycardia syndrome. POTS stands for postural orthostatic tachycardia syndrome. Posture has to do with your body's posture or position. Orthostatic is a drop in blood pressure when going from a sitting, laying position to a standing position. And tachycardia is a fast heart rate. This is diagnosed by a tilt table test. It is often accompanied by dizziness, fatigue, and rapid heart rate while going from a sitting or lying down position to a standing position. Respiratory complications, shortness of breath, dystonia, which in this case is failure of the chest wall muscles to allow the chest to expand. Dystonia in any part of the body is the muscles clamping down in a spasm where then you are unable to move them. Inability to take a deep breath. And some patients actually went into heart failure. Autonomic dysregulation. This is something that's often seen with spinal cord injuries, but is also seen with CRPS. Normally, there is an increase in heart rate when the blood pressure falls. This is a compensatory reflex-induced reaction. Failure of the compensatory reflex-induced response is a manifestation of the autonomic dysregulation. Autonomic dysregulation has both a peripheral and central nervous system component. Early on, a CRPS affected limb may be warm, but over time it becomes cold, which suggests changes in the vasomotor and in the spine are taking place. Pseudomotor function refers to the autonomic nervous system control of the sweat glands, activity in response to environment and individual factors are distributed by CRPS. I definitely am always hot and always sweating. It can be freezing cold to everyone else, but my body thinks that it is hot and profusely sweats. Pseudomotor dysregulation causes the following symptoms: inflammation, as described by glial cells giving off cytokinins; excessive sweating at rest; mottling of the affected limb; neuropathic swelling, which is resistant to diuretics, which are chemical medications that help the fluid from the swelling to come out of the tissues and into the bladder to be peed out. Cold affected extremity with color change, often misdiagnosed as Raynaud's syndrome. And if you review back to the symptoms of CRPS, then you'll be able to see what the mottling and the swelling look like in photos. Effects on the musculoskeletal system. This affects almost all people with CRPS and includes weakness, atrophy, which is muscle wasting of the affected limb, demineralization of bone, such as osteoporosis, pathological fractures of bone while doing normal activities, and these fractures are hard to heal. Due to relentless pain, the endocrine effects include fatigue, hypothyroidism, which is low levels of thyroid hormones in the body, adrenal dysfunction, which causes low cortisol levels, inflammation process response that causes cytokinins to mediate illnesses such as malignancy, human immunodeficiency, HIV, Epstein-Barr, and other viral infections, as well as pituitary dysfunction. Dermatological manifestations include changes in the color of the skin, hair changes. Either the extremity has much more hair or no hair at all as compared to the unaffected limb. Lesions. CRPS lesions can be very difficult to treat and often become infected. Over time, the skin appears shiny and edematous, which means swollen, bruising in areas that are not injured. Neurologic symptoms seen in about 25% of people with CRPS. They have urgency, incontinence, pelvic and perineal pain are common in those with CRPS of the lower limbs. Interstitial cystitis, which is inflammation of the bladder causing bladder pain. The interstitial cystitis can be caused by the CRPS, and those that have it, often ketamine makes it worse. So there is an interstitial protocol that can be used by everybody, but especially by those who have interstitial cystitis. gastrointestinal changes, which GI, constipation or unexplained bouts of diarrhea, nausea, a feeling of food being stuck in the esophagus, gastroparesis, slowing of the digestive system with delayed stomach emptying. And again, this will be discussed in length in a future show. Cyclic vomiting. A word of caution: do not assume that every new symptom is due to CRPS. This can delay diagnosis of completely different problems going on. For example, in 2006, I began having severe back pains after moving from Pennsylvania to Florida. I mistakenly blamed it on CRPS, and for one whole year, did not have any kind of imaging done. When finally my neurologist wrote for an MRI, we found I had 2 blown discs. So that taught me a lesson to, no matter what the symptom is, even if you think it's related to CRPS, have it checked out so that you know for sure. So look forward over the next 2 months to see weekly shows on these comorbidities. Thank you for watching. Today we have Carrie with us, and she's going to touch on all the things that I've mentioned in the 2 Dr. Schwartzman articles that we've discussed. So how long have you had CRPS?
I actually just passed 20 years since my injury,
Okay.
and I'm exactly 2 months away from the 20-year anniversary of my diagnosis.
Okay. Well, that was pretty quick diagnosis then
Yes,
for that
yes,
time period.
very fast,
Yeah,
which,
because I was 2 years.
yeah, I know most people go a lot longer. I was very lucky that I was diagnosed right away.
I also know that you also went to Germany, or did you go to
I
Mexico?
went to Mexico,
Okay.
yes,
Okay.
for
I
the
knew you
ketamine
had.
coma and subsequent high dose inpatient infusions with surgeries.
Right.
Yeah.
So what we want to talk about is when you've had CRPS, as long as you and I have, I'm on 28 years. Um, what kind of complications, for lack of a better word, um, go along with having long-term CRPS? And we're going to kind of take this by system because that's how the article does.
Sounds like a
So
plan.
we'll start with gastrointestinal. And you mentioned to me you have reflux and gastroparesis. Can you
Yes.
talk briefly about that?
The reflux has been a pretty severe chronic thing for ever since I became bedridden in 2013. That got severely worse. It started probably only like a year and a half after I got the CRPS, but then it progressed to GERD when I became bedridden. And that will sometimes affect my eating because it's
Right.
just too painful. Yeah.
Did it come before or after the gastroparesis?
It came before.
Okay, because I was going to say a good reason might be if you had gastroparesis first.
Right.
And just for the audience benefit, we're going to go through each one of these diagnoses as a separate show. So then you developed gastroparesis. Can you briefly tell us about that?
Yes, when I had my relapse after my coma, um, that was when it really kicked into full gear of when I was struggling with it. And that was when I had to start seeing, following with a GI doctor, make sure I was taking medications to help me be able to go and keep things moving. But it was after a relapse that.
Right. And gastroparesis is slowing of the digestive system. Now, a lot of people also have absorption issues with their gastroparesis. Do you have any problems with absorbing or needing vitamin supplements?
I need to take uh, magnesium all the time.
Yeah.
That one is always low. And if I don't take it, then I start getting a lot of neurological symptoms.
Yeah. And also medications for GERD prevent you from absorbing magnesium.
Okay.
So they should actually be taken at opposite times.
Okay.
I take Dexalon in the morning, I take magnesium at bedtime.
Okay.
That's how I'm able to keep it within normal limits. So obviously, CRPS is a neurologic disease, but you have two other issues that are, again, comorbidities or complications of CRPS, dystonia and dysphagia. Can you briefly explain that?
Yes, the dystonia started about a year in, where I would have either episodes of I was trying to move and things wouldn't move, or I've also had times where things have gotten so tight and it lasts for months on end
Oh, wow.
until we can break the cycle. Yeah. So I'm currently on 3 muscle relaxers to keep functioning with the dystonia.
Have they ever tried um, a mental health medication? Because there are some that also help with it better than
Yeah,
muscle relaxant.
yeah, I'm on Cymbalta,
Okay.
and but that's the only
Okay.
one. For which ones typically help with that?
And then the dysphagia.
Oh, that I've had trouble with probably 19 years, but it really started when I became bedridden. I had a bad episode of um, thrush that was throughout my entire GI system. And that caused the swallowing issues. And I had actually lost the ability to swallow for a little bit. And once that episode was over, the swallowing issues still last a little bit. It's more like things get stuck.
Yeah, all the time.
You can breathe, but it's uncomfortable.
Yes. Okay, so we're going to move on to respiratory. And you said after you got CRPS, you started with asthma.
Yes, I had a horrible bout with bronchitis where I went months on antibiotics trying to fight it off. And after that, I had to stay on an inhaler for a very long time. It's improved when I get um, the ketamine treatments and stuff. Dr. Schwartzman thought it was directly related to the CRPS, almost as if I injured my lungs.
Yeah, and some people have respiratory issues because the muscles around their rib cage tighten up and not allowing them to get a deep breath.
Yes, I get that too with the dystonia.
Right.
Yeah.
So musculoskeletal osteoporosis, which is extremely common with
Yes.
people with CRPS for a
Yes.
number of reasons.
Yes.
So how have you dealt with that?
Well, I knew many years ago that I at least had osteopenia in my leg because it showed up on an MRI, but it wasn't diagnosed as osteoporosis until a little over a year ago when I had a DEXA scan. And a lot of the readings were as bad as you could get. Now,
Right.
unfortunately, I haven't been able to start treatment because I've needed dental work done. And they say that when you are on osteoporosis medications, that you don't heal as quickly and
Right.
properly, especially with dental stuff. So I've been getting all of that done. And once that's fully healed, then I can start treatment.
Right. Now, in a previous show, I spoke with someone who was actually getting an osteoporosis medication to treat his CRPS.
Oh, wow.
So when you get to that point where you're ready, you might want to discuss what different ones.
Yes, for
The
sure.
other thing is that it's most osteoporosis medications are in the biophosphate range. And one of the side effects is um, frequent femur fractures from something that would not normally cause a femur fracture.
Okay.
And I have three family members who that happened to, that like, just a simple trip over something on the floor. Uh,
Uh-huh.
Normally, it takes a lot of force to break a femur. And if a child breaks a femur, they automatically consider child abuse because of
Wow.
the amount of force. So
Wow.
it's just something to be aware of if you start having any kind of pain in your thigh to have an x-ray done.
Okay. I right now currently you can probably see I'm in a power chair and I don't
Right.
walk at all. I can't stand because I can't hold my own weight. So I don't
And
have to worry
that
about
also,
tripping right now, but
right,
that's why the osteoporosis is so severe.
right, because you're not doing any weight-bearing exercise. But it doesn't mean that it couldn't happen if something dropped on your thigh.
Yes,
It's just
that's
something
very
to be
true.
aware of as a side effect. So in the endocrine, um, I also have hypothyroidism,
Okay.
chronic fatigue syndrome. So how are they differentiating the chronic fatigue syndrome from the exhaustion that goes on with POTS and CRPS?
Well, I was just kind of I feel like all of this is directly related to the CRPS, but that diagnosis has been thrown around when I've
Right.
described my symptoms. When I get extremely fatigued, I start having flu like symptoms
Okay.
and get body aches. I'll start to run a low fever. And the only thing I can do, and sometimes a sore throat, and the only thing I can do is rest.
Yeah. And skin, another very prominent side effect of CRPS are skin lesions. You said you also have mouth lesions.
Yeah, for me, the mouth lesions are more prevalent, and I have to use medicated mouthwash
Right.
every day. The skin lesions occur if I have a very bad flare, like a severe injury, then I'll start to get the skin lesions. But thankfully, I don't deal with them on a daily basis.
Right. And then the genitourinary system, you have interstitial cystitis. First, let's say what that is. And secondly, is it ketamine related?
Okay, so it's inflammation of the bladder.
Right.
And interestingly, mine was diagnosed when I had my hysterectomy, and the doctor got a look at my bladder
Okay.
and could see that it was completely inflamed.
Hmm.
I had been struggling for years and years with bladder issues before that, but then that's when the diagnosis came in.
And that was
But from
after you had ketamine, correct? Or
it,
before you started?
no, it was after I
Okay.
started with ketamine, but for me, my bladder function gets better after I have infusions.
Okay. So does mine.
Yeah, yeah.
All right. And finally, cardiovascular, and that's POTS, which is postural orthostatic tachycardia syndrome.
Yes.
How far into CRPS were you diagnosed with that?
It took, I think, 4 years in to be diagnosed, but I had started having problems only about a year into the initial onset of the CRPS. It just was not consistent enough to get the diagnosis until it got to the point where I was passing out multiple times a day.
And just as a side note, 28 years into it, I was just diagnosed with POTS.
Oh, wow. Okay.
Yeah. Who would have thought that this long things would start popping up, but
Right, right.
they have. Well, I thank you so much for your time and your explanations.
Yes, no problem. I'm glad. I hope this can help. And thanks for all that you're doing with creating these videos to educate everyone.
Thank you.